Dr. Abigail Ahibime. I am a staff of the Faculty of Pharmacy, Department of Pharmacology. I specialize in neuropharmacology. That's the area that talks about effects of substances like drugs on the brain cells. Alright, so this morning we'll be talking about the effects of Tramadol and Codeine. We will be looking at the use, because these drugs are actually used legally. However, they are often abused. So today we'll be looking at the effects of this drug as how it relates to the central nervous system and the brain. Codeine and Tramadol are actually controlled substances, as we know, some of us know. However, people buy them over the counter. When I say over the counter, I mean they buy them without a prescription. They are actually drugs that should be sold with a prescription. These drugs, for instance, let's start from Tramadol. Tramadol is actually an opiate. Now, let me not speak in pharmacological terms. Alright, so it's a drug that are actually used to treat pain. Alright, so it could be moderate to severe pain. For instance, you have toothache. Alright, so you take Panadol, you've done strenuous exercise, or you have muscle pains. Alright, so you take Tramadol. Now, it's often not the first line drug when a patient comes down with pain, because the patient can develop tolerance. But when I mean tolerance, the patient can become so attached. Now let me come down to so attached to the drug that even after the pain has subsided, the patient still wants to take this medication. Alright, so it's not the first line drug in treatment of pain. You have other drugs. Alright, so you might start with maybe paracetamol. Alright, you proceed. If the pain still doesn't resolve, you can give drugs like ibuprofen. Alright, so there are instances where you have to actually administer Tramadol. For instance, a patient that has ulcer, ibuprofen is contraindicated in such patients. Alright, so you want to give Tramadol to such a patient. Alright, the same also goes for Codeine. Codeine is also an opiate, alright, and it acts through the brain. It's also a drug of dependence. Now you find Codeine everywhere. It's in cough syrups. It's also used in treatment of pain, mainly as an antidote. It's also used in treatment of cough. I don't want to be speaking big language. Alright, so let me just go down. Alright, so it's used in treatment of cough. You find it in most cough mixtures. And then you find out that patients that actually abuse Codeine, they tend to take it through that means. When I mean through that means, it means that they go to the counter and they complain of cough, as the case might be, and that's how they grab such. And these drugs actually have effects. For instance, Codeine, when it's metabolized in the body, it's metabolized to morphine. And as you know, morphine is it's also a drug of abuse. Alright, so all of these three classes or two classes of drugs that we'll be talking about today, Tramadol, Codeine, they actually act on the brain. For instance, you administer Codeine or Tramadol to a patient and you give the least possible dose as possible. After maybe a few weeks on that drug, you find such a patient at that same dose, you might not get that same response. That the pain that dose would have relieved the patient doesn't get relieved at that dose. Alright, so in pharmacological terms, we say tolerance has set in. Alright, so the patient has become tolerant to the drug, as the case might be. Alright, so if it is an ideal situation, you might want to either increase the dose, as of course you would have started with a lower dose, alright, or you want to change the medication the patient off it. And in our society today, 90% of patients on Tramadol, Codeine, they buy it without a prescription. And that's the honest truth. They get it without a prescription, and it's not supposed to be so. These drugs, like I said earlier, are prescription-only medicines. So a patient walks in and says, I want to buy Codeine, walks into a pharmacy premise. The patient should not get it without a prescription, because most of the times, these patients have developed tolerance to it, and then you find them, they now abuse the drug, so to speak. Now, when you talk about, there's what we call drug abuse and drug misuse. Drug abuse is when a patient takes the drug when the indication is not there. For instance, like I talked about pain and I talked about cough. Alright, so this patient doesn't have pain and he doesn't have cough. Alright, so he wants to abuse the drug. Drug misuse is when the patient doesn't know. Oh, I didn't know that. Oh, I'm not supposed to take Codeine. Now that's a misuse. Oh, I was supposed to take this drug, not this drug. That's misuse. But abuse is when there's no indication for that drug. The patient takes it. Alright, so that's the difference. most of our youths these days, we find them abusing the drug. Now, why would they take tramadol? Tramadol actually, it gives this euphoric, so the patient feels high. It feels, it's a sense of a false sense of well-being actually, because you can't just get that feeling from the use of drug. You could relax. If you feel tired, you take a break. So codeine also gives euphoric feelings. And then you look at the implications afterwards. Now there's the cost implication. You see, users or individuals that abuse these drugs, you find them telling lies. For instance, the youth, a child will tell his father lies. Oh, I need to pay my school fees just to get out funds to buy this drug. And then if he's in an environment where he really needs a prescription to get the drug, he does what is called prescription shopping. Alright, so he moves from this doctor, get a prescription, moves to another doctor, get a prescription. Alright, so he has a lot of prescriptions that can last him for over a month. Now, even though he doesn't have a prescription that will last him for over a month, he can devise other means. He can go and shoplift the drug. Alright, so he walks into a pharmacy and he knows he needs a prescription. Alright, so he goes there and just picks the drug and puts it in his pocket. Alright, I had an incident. I was working in a place and there was this lady that was always coming in. She would just walk in, and it was supposed to be a prescription only medicine, but it was on the shelf. Alright, and then we had like a mini mart also in the pharmacy. Alright, so she had the opportunity to pick up chocolate, pick up this, pick up that. Alright, so she would go pick up chocolate and other things. She would distract everybody, and at the end of the day, what she's coming for is codeine. She's actually coming for a cough mixture that has codeine. And when she comes in and doesn't find it there, in fact, she will make a lot of trouble. Now you find it's really bad because the abuse has even gone beyond just taking codeine. You now find them, they mix it up with other things. You find them mixing it up with beer, Heineken, what have you. They mix it up with all just to get that. And it's really bad. And then you find out that at some point, these individuals want to actually stop, but they can't stop. Now, they can't stop because there's what we call withdrawal symptoms. Alright, so they make up their mind, oh, today I'm not going back to it. Maybe they shoplifted and then they were embarrassed or they were caught and all that. Alright, so they make up their mind and like, oh, I'm not going back to this. I want to put an end to this. It's actually possible, but the withdrawal symptoms, like I was going to say, you find them, they are agitated. You find other CNS effects, like you find them, some of them, they develop tremor. They shake. You find all the muscular, there's what we call muscle rigidity. Alright, so the patient is sweating all over. He can't just, he's irritable, he's nervous. I don't know if you've ever been in that kind of situation. Alright, so the individual is nervous. He's just restless. He can't sit in a particular position. Alright, so those are what we call withdrawal syndromes. Now,
people finding it more interesting mixing the tramadol with coke, beer. Is there any health implication?
Tramadol, morphine, these drugs are metabolized in the liver, the kidney, as the case might be. Alright, so when you take it over, and of course, like we say in pharmacology, there is no drug without a side effect. It's the dose that makes the difference. Alright, so even paracetamol that we all take, if you take it in excess, will cause hepatic failure. You have alright, so there's no drug without a side effect. It's the dose that actually make it different. Alright, so in these individuals, when they take it for a very long time, you find them coming down with liver damage, kidney damage. Those are the health implications that these individuals come down with. And sometimes, the withdrawal symptoms that I mentioned earlier, you also find hallucination. Now, when I say hallucination, you find them, oh, they are just speaking to themselves. Now, those are part of the effects of the drugs. Alright, you find them hallucinating. Sometimes some of them even convulse in the process of trying to withdraw from the drug. Alright, of course, beer, all those are they are normal barley wheat that we have. Alcohol. Alcohol is actually a CNS substance. It depresses the CNS. When I say depresses the CNS, the same way. Alright, so the patient takes alcohol and feels a sense of pleasure and well-being. Alright, so I'm wondering, I've not taken codeine and I've not taken alcohol before. So I'm wondering what height of pleasure they actually derive when they make a mixture of both.
Also throw more light on this issue of hallucination. Somebody that are taking codeine or tramadol, sitting in a place trying to like, some of them talk as if they are mad. I want you to talk about the health implication of hallucination.
Well, now that there's olfactory hallucination. He hears what every other person cannot hear. Yes, there's tactile hallucination. He feels what every other person cannot hear. Alright, so there are various forms of hallucination. Hallucination, you see hallucination mainly in psychiatric individuals, patients with that are non-stable psychiatric patients. Alright, so you find that with individuals. Alright, so these are extreme cases of withdrawal syndrome. Alright, so of course, when you are sitting down with your counterpart and then you are behaving abnormally, it lands the patient, and of course you now have to start treating all of that. If the patient comes down with symptoms of psychosis, it's either you want, of course you cannot introduce the drug to maintain the state of the well-being. Alright, so you want to symptomatically treat such individuals. Alright, so you find out that the abuse of codeine and trauma has health implications, it has economic implications, financial implications, it has social implications also, because after a while, once you walk into a place, everybody knows, oh, this guy wants to steal. You lose trust amongst friends, colleagues, people, family members. Maybe you've come out clean, but they won't know. It will take a while before anybody believes you. The withdrawal syndrome or symptoms can actually be treated. So in such individuals, so when you want to treat them, it's either you taper the dose gradually. Alright, so these symptoms, after a while they wear off, and it's advisable to meet an expert when you want to treat that. It's usually advised that, oh, you meet an expert. Alright, so they guide you, counsel you all through the process, than having to do it all on your own. That's not to say that some people cannot actually do it on with dedication, motivation, and encouragement from maybe family members, they are able to stay and win themselves off the drugs. However, some individuals that might lack low motivation and less maybe they have low self-esteem, they have other individuals. Alright, so you have groups where everybody comes and talks about his particular situation, his scenario, what led to that, and all of that. Okay, so they help each other, and after a while, years, these effects actually wear off.
You talked about people finding it more interesting mixing tramadol with coke, beer. Is there any health implication?
Tramadol, morphine, these drugs are metabolized in the liver, the kidney, as the case might be. Alright, so when you take it over, and of course, like we say in pharmacology, there is no drug without a side effect. It's the dose that makes the difference. Alright, so even paracetamol that we all take, if you take it in excess, will cause hepatic failure. There's no drug without a side effect. It's the dose that actually make a difference. Alright, so in these individuals, when they take it for a very long time, you find them coming down with liver damage, kidney damage. Those are the health implications that these individuals come down with. And sometimes, the withdrawal symptoms that I mentioned earlier, you also find hallucination. Now, when I say hallucination, you find them, oh, they are just speaking to themselves. Now, those are part of the effects of the drugs. Alright, you find them hallucinating. Sometimes some of them even convulse in the process of trying to withdraw from the drug. Alright, of course, beer, all those are they are normal barley wheat that we have. You know, alcohol is actually a CNS substance. It depresses the CNS. When I say depresses the CNS, the same way, alright, so the patient takes alcohol and feels a sense of pleasure and well-being. Alright, so I'm wondering, I've not taken codeine and I've not taken alcohol before. So I'm wondering what height of pleasure they actually derive when they make a mixture of both.
Get either come from friends or people that they depend on. Like if you have someone that you look up to as a mentor now, and you're always with the person, sometimes he wants you to do what he's doing.
Yes, it's the same thing that goes down. It also boils down to parents. How do you parent your child? I was discussing this week with a colleague. We were talking about the advantage of boarding house and day school, and I said, no matter what, my child will go to a day school because you are able to monitor the child. And then once you notice a deviation in the child, you can correct it immediately. However, you leave your child at the expense of the teachers, the housemaster, and every other child, so the school gives you 50%, your 50% is missing. That's the point. So the school gives you 50%, but your 50% as a parent is missing. Now it takes the grace of God for a child to go and leave the parent and then come out. So you find out that it's easier to train up a child up to maybe 18 when the child has a mind of his own. Alright, so you can, that's why you find out that most universities will not accept a child of 13. You won't find a child of 13 years in the university because that child doesn't have a mind of his own at that point in time. Alright, so at those tender age, parental influence is very important. Alright, so the parent has a lot of role to play. And you should not shy away from discussing with your children. Talk to them about rape, talk to them about drug abuse. So when they get into the society, it's not new. Alright, so, somebody says, I have something. You say, what is the thing? My daddy, is it that thing my daddy told me? Alright, so the child already has an idea. And the curious mind is not. Alright, so you as a parent, you have dissuaded your child. Alright, so when it gets into the society, the school, you will find out that these things will seep into our day schools, our secondary schools, if it's not already there. Alright, because of course you are here, you hear issues of cults in secondary schools. Alright, so if it's not already there, it will still seep in. And then when it gets there, it takes an already prepared mind, a child with an already prepared heart. Alright, to say, oh no, my father discussed this with me, and then the child is able to say no. However, a child that has never heard of it, oh, it's curious, I want to know. However, they say it will make me feel good. Okay, I want to feel good. They say, oh, if I take it, I will spend longer hours reading. Well, in the long term benefit, you go for the exam and then you are blank. Alright, so we should discuss with our children as parents.
Yeah, sure, you can meet me.
Okay. What's your name, sir?
I'm Mr. Lucky. Friends call me King Cool.
Okay. King Cool. What do you know about Tramadol and Codeine?
Yeah, I think generally Tramadol and Codeine shouldn't be sold for any other persons. If you have to go to the pharmacy, at first you have to come with a doctor prescription before such drugs could be administered to you or being sold to you. A lot of individuals nowadays, they abuse Tramadol by taking excess of it. Let's say, for instance, the doctor could ask you to take 50 milligrams of Tramadol just to release you from some pains that you're going through at that moment. Some will go to the pharmacies and tell the pharmacist to give them like about 500 milligrams, which is so high. So you taking 500 milligrams, just try and imagine what it's going to do to you. If 50 milligrams can make you go lazy, that shows that 500 milligrams can really make you go weak, and you can even sleep and without you waking up the next day.
Okay, sir, what do people derive from this intake of Tramadol? I mean, excess intake of Tramadol.
I've seen some guys that take Tramadol, they just feel the fun on it. They just want to be lazy, don't want to do anything. They just want to. How do I put it now? They just want to feel lazy, so that when you see them, you say, man, this guy is really high. It's just slow. They like the slow moment of it.
Okay. So as you can see, this is from Echo TV, Environment and UTV show. So we want you to advise the public what they should do when it comes to Tramadol use now.
I think generally, like I said before they should give you such drugs, you need to consult your doctor first if you can take such drugs. I can remember then when I had an accident, I was given the first injection I was given was Tramadol injection, just to soften the pain, so that when they are doing the surgery I shouldn't feel any pain and all that. So my advice generally is that they shouldn't sell Tramadol to any other person. Before they give you that drugs, they have to see your doctor prescription before such drugs can be sold to you.
Okay, thank you very much. It's nice talking to you.
I'm Andrew Akabwe.
Andrew Akabwe. So have you heard of Tramadol before?
Yes, of course.
Okay. So what can you say about Tramadol abuse?
Tramadol abuse basically is a phenomenon we should discourage, because Tramadol has some negative side effects and health effects that should be avoided. And it's a drug that is classified under the prescription drugs. That is, you are advised to take it only when it is necessary, and only when a doctor has prescribed it for you. So abusing it is going against your health, what will I call it now? The good of your health, because it has negative side effects.
So what are the negative side effects of long-term abuse of Tramadol?
There are a myriad of activities, but chief among them is that it causes a respiratory depression as a result of CNS depression. And that can lead to a myriad of other activities medically.
Okay. So what about organs like liver, kidney? Can it also affect them?
It can lead to those damages. Okay. Well, that's only on long-term use.
Okay. It's nice talking to you. Thank you very much. Your name?
My name is Olabayo. My people they call me JJ.
JJ.
Yeah.
Okay. You don't hear of Tramadol?
I don't hear of Tramadol. I don't hear well.
So what did they use Tramadol to do?
And that Tramadol now, as people they use that, it depends on what thing you want to use them for.
Okay.
Some people go they use that and say they want to use that and walk. I want to say on the side where people they use, like when they talk about a Tramadol now, some people feel use that and say, my babe they come just for me to get power.
Huh? So your babe they come, you go take Tramadol?
People they use it like that. Okay. It depends on different people way of life.
Okay.
You see, when they talk about Tramadol now, some people feel they take an okay, my user go do work, but different people with different ways of doing things. Okay. That's just what I just see for this issue of Tramadol.
Okay. So this Tramadol they talk about, so it get any bad effect for body?
You go surely get now. As they see and so, Tramadol, the excess usage, now they cause problem for body. Because if you take Tramadol now, person we supposed to take 100 milligram, we go take 500, 600, 1000. The more you take excess, the more it goes damage to the body. That's just the side effect we I fit talk about the.
Okay, so what you advise people when they watch you now? What you advise them about Tramadol?
My advice for people where they use Tramadol be say you must take it until the doctor prescription. If doctor no prescribe you say me will take Tramadol, me will not take am, because mostly waiting I hear be say Tramadol is meant for people on psychiatric issue. That's what I know about that to my own perception. But people just take am excessively due to the way of life, or I want to be among of those people that are taking it.
Bro, it's too much, I throw.